You know what just hit me? I was actually thinking, if you're having mental, and I know this might be a little over the top, or maybe just throwing fuel on the fire, but like if you have mental health issues that are plaguing you, it would be interesting to go through that process of actually learning the qualification, because you'll get to know like the drivers behind all of your thoughts and your behaviors and you'll be able to kind of hopefully see through the lies that you tell yourself about your situation.
Absolutely. Absolutely. There's a type of therapy that I like a lot, cognitive behavioral therapy, or CBT. And CBT, just in a nutshell, the very first form of documented therapy that we had was Sigmund Freud's psychoanalytic therapy, or psychodynamic psychotherapy, which is the typical therapy that I think most people think about, especially if they're of age, to see people on the couch. There's even a SpongeBob episode where Plankton's trying to steal the recipe and he puts SpongeBob on the couch. And that, I think, resonates with a lot of people because that's the thing you typically think about with therapy, but it's actually a very uncommon therapy right now. It's incredibly time intensive and it's incredibly expensive. So Dr. Alan Back basically created a spinoff of that, which is CBT, or cognitive behavioral therapy, where you take the time to focus on your thoughts, assess them and see whether or not they are factual, not factual, if there's a distortion, cognitive distortion related to it, address how it makes you feel, and then see how it causes you to impulsively behave. So your automatic behavior, your automatic thought driving an automatic behavior, and then assessing that. And once you go through that whole thought process, you go back and you say, okay, what would an alternative behavior have been? So the hope is the next time that you process your thoughts, you think about that and you don't act the same way that you did before. So you start breaking habits. And it's a lengthy process, but I think it's a more long term and long standing process. I was talking to a woman recently, and she does a form of NLF therapy, and basically she worked with lots of executives and coaches and folks in leadership because they've got an event or something coming up, and they need to um, basically be on their top game within like hours or days. And
Can
so
you
when
do
folks
that? Is that even
you can.
possible?
It is possible. Now, they use a form of basically, it's similar to a form of hypnotherapy where they start uncovering things and help you deal with certain things. And I'm not saying that's not a good idea. I think it can be useful for some folks, but it really is like a quick fix. And if you can imagine any quick fix, it's going to work for a little while, but then you're probably going to revert back to the way that you were doing things before. And I think that's where focusing on something like CBT, and we were talking about that, because she's a great person to go to if you need a quick fix like today. Like you've got a speaking engagement tomorrow and you've got to get over a fear of whatever speaking in like a day. That would be more her area. But if after that particular event you decide, well, you know what, I want to take care of this for the long term and never have to deal with this again, then doing CBT is, in my opinion, the better, longer acting and longer lasting approach.
That is so interesting to me that there's actually a quick fix for mental health. I never even thought about it. Now, I get that if you breathe deeply and if you find a way to relax, and if you can be present through meditation or like any kind of practice like
Mhm.
that, then I get that that's also kind of like a quick fix because you're not dealing with the underlying causes, but you're alleviating the symptoms by relaxing your body, by calming your mind. But it just really is interesting to me that there's actually a therapy for high achievers, or that is being applied to high achievers as a way for them to be able to deal with highly anxiety inducing events like talking in public or whatnot. I should really look into that for when I get on Clubhouse, etc.
Yeah, absolutely. And we'll do a couple of sessions and then you'll get it and you'll be like, oh, this is awesome. The proviso that I have, and the main reservation that I have though, is that hypnotherapy and anything that you're using to just kind of put yourself into, I don't want to say a trance-like state, but basically where you're kind of disconnecting a little bit from some of those feelings and emotions. The concern I have is that if you have a history of trauma, I personally don't recommend that you do that. Now, some people don't even recognize that they have a history of trauma or PTSD, but if you know that you do, I recommend that you not do that because of the tendency to disassociate. And if anybody's ever heard, it's very rare, but if anybody's ever heard of the old multiple personality disorder, it's now called dissociative identity disorder. I do know some folks that when they are in a traumatized state of mind, and then they've had hypnosis, they've had a really, really, really hard time coming out of the hypnosis. And when they do come out of the hypnosis, they're actually worse than when they went in. They're complaining of, having even more dissociative episodes or higher anxiety. The anxiety piece is the biggest part. So I just tell, it's kind of like a buyer beware kind of thing. If you already know that there's some issues that you're dealing with, some severe, childhood abuse, or you've had, a horrific accident and it's caused you to have some trauma symptoms, those are times that I would say you might not want that quick fix approach. It can do more harm than good.
Right. And on that note, just for the benefit of everyone listening, can we go through a little bit about what your background is? Because I think people might be interested at this point to try to understand, like, where are you coming from when it comes to psychiatry, psychology, and all that. So what did you
Yes.
specialize in? What kind of therapy have you provided or given in the past? And what are you focusing on now, for example?
Yeah. So I am a board certified psychiatrist, which means that I am a medical doctor. We go to medical school and then we complete a separate residency in the field of psychiatry. And once you're in the field of psychiatry, you can branch out to all kinds of different subspecialties. The area that I do the majority of my work is in the trauma space. So I do trauma informed therapy, and there are a variety of types of trauma informed therapy. So for children, typically, the most common one is trauma focused CBT, or that cognitive behavioral therapy that I spoke of before. When I'm working with a person who has no major traumas, but they certainly have some incident or some issue that they're trying to deal with, and it's affecting their performance, it's affecting their productivity, they're overwhelmed by emotions, then we'll use the CBT. If they specifically have a trauma that we want to work through, I start out with CBT and then I transition over to CPT, lots of alphabets here. But CPT is cognitive processing therapy. That's a separate kind of therapy that's specifically for folks who've had a history of trauma. Now, the best data that we have, or at least the most voluminous data that we have, comes out of the military, right? That's where we first started talking about the effects of trauma. First, there was, shell shock syndrome, and then it evolved into PTSD, and now we talk about, other um, post stress related post traumatic stress related disorders. So when we're thinking about these things, I like to tell people that I think that there's a therapy for everybody. It may not have a specific name, but you may have to combine things. So, for example, the CBT approach, I don't know of too many other people that do that. I kind of just combine them basically in therapy for time purposes. Time seems to be the limiting factor. Of course, we don't get time back, but I'm usually having folks that come to me and it's a time sensitive thing. I do a lot of work with folks who've had personal injuries and workman's compensation. And usually it's one of those things where they have to get back to work as efficiently and swiftly as possible. So, although a typical round of CPT might be 12 weeks, I might be given by, their employee program, or they're getting ready to send this executive off to some other place, or this person's being deployed in the military. I have 6 weeks. So that's one of the reasons that I combine those kinds of therapies. And so it's one of those things that doesn't really have a lot of research associated with looking at it that in that particular way. CBT by itself, great deal of research. CPT by itself, again, phenomenal amount of research, especially coming out of the VA. Putting them together and getting them done in 6 weeks, not a lot of research out there. To my knowledge, there's really no major studies that have been done. So one of the things that I'm doing right now, two areas that I work on, one, which is looking at the effects of the CBT CPT approach and seeing um, how fast people are able to get back to doing the things that they love doing, right? And how fast they're able to be efficient and productive. And then the other area is how we can translate that information that we're looking at now into faith-based organizations, because there are no real protocols for faith-based organizations. We've got great protocols for organizations in general, but as you could probably imagine, when you talk about faith-based organizations, it can kind of take on a slightly different turn. It's not just I'm
Faith
frustrated
based,
because
as in faith,
Mhm.
as in like religious faith, or how does that?
Yes.
Right.
Yes, absolutely. So right now, if you go to CDC or World Health Organization, or you go to Department of Health and Human Services for those who are here in the United States, and some other national councils, there are there's, I don't want to say volumes, but there's lots and lots of data and lots of research about being a trauma informed organization. There's lots of information out about that, and there are protocols, and there are tools, assessment tools, for example, that you can utilize to see, okay, is my organization's trauma informed? So let's say I went to Amazon or Google or IKEA or wherever, and they said, we don't know if our programs that we have here for our employees are trauma informed. We just don't know if they meet that level of stringency. There is an assessment tool that I can utilize for those organizations. Now, let's say and again, we're thinking about churches are like huge. Some churches are the size of other organizations. You think about our mega churches. I'm thinking about, for example, TD Jakes has the Potter's House in, I think, Texas, and Joel Olstein. I mean, these are churches that have tens of thousands of members, right? And so you've got a lot of people in a small space, thinking about pre-COVID, but even now, you've got a lot of people, in various setups. Is that a trauma-informed setup? When a person walks through your door, or a person comes online to meet with you, are they going to have to navigate all these things that are re-traumatizing? There is no standard for churches. There is no standard for faith-based
And it's
congregations.
because
There's
you
no
you
standard for
know for a
synagogues.
fact that when it comes to churches, that's where trauma surfaces, because it is inherently one of the reasons why people seek faith, is because they're looking for maybe a solution to the ills of life, right?
Right.
Is that why you're doing that?
That's one reason. One, they're looking for a solution. Sometimes they're just looking for comfort. There other times people are just looking for someone to validate what they're going through, and so they'll often go to a pastor or counselor. I was looking at some research data that came out from late 1990s, early 2000s, and it was saying that before a person will go and see a therapist or a counselor, and I love the fact that you're going to go and get some additional education, but before a person will come and see you, once you've got that training, they're going to come on your podcast and talk to you. They're going to come and talk to you in a clubhouse room. They're going to go and speak to a pastor or a person in their women's group long before they come see me. And then I noticed in that same set of data, now this was just one study in one area, Florida, I believe, but once they come and see a person like me, and they go and talk to a pastor, the percentage of people that felt more supported was actually with the pastor. 60% of people felt better after talking with a psychiatrist or a psychologist. 94% of people felt better after talking to a pastor. That statistic just blows my mind. Now, these were people, again, who were in a church, in a congregation, so they're already connected to a person who they consider, a faith-based leader. But it was still very striking for me that when a person is hurting, those are usually the people that you reach out to. Those are the people that you think have the answers. And again, there's also this stigma with mental health providers. So I want to make sure that our churches are more equipped, or our congregations are more equipped, so that when someone comes to you, like for example, last year with COVID, the domestic, we used to call it domestic violence, but intimate partner violence, in terms of folks crying out for help and that coming to the forefront, that was huge last year. The alcohol numbers, the numbers of alcohol use just shot through the roof last year. Online alcohol sales, I think, increased like 300% in
Yeah.
2020.
Yeah, I
So
was
you see
probably
folks.
also in a part of that figure, even though I
Yeah, I
quit
mean,
drinking
folks that
last year.
have, just general people that are like, oh, I don't feel like going to the ABC store or whatever you call it. I'm just going to order it online. That absolutely, there were folks that were represented by that. But we also know that there were a significant group of people that when they did finally present to a healthcare provider or to someone else, they did say, yeah, I was sober. And now I've kind of, used to use that term falling off the wagon, but, I've had a relapse, or I was in remission and recovery, but now I've had some difficulties and I'm having a really hard time and I need help. So yeah, I think churches or your synagogue or your mosque. Those are the places people are going to go to first.
Hmm. Can I ask you a question, like a personal question? Are you religious?
Yeah, I identify as Christian. So when you were asking about my title earlier, I was going to say, well, before I was a psychiatrist, I grew up. I was raised in a church, and I grew up with a great respect for the faith system, and I was able to see firsthand folks that literally were able to have their lives transformed by being connected. And a lot of times it was about being connected to supportive people, being connected to someone who literally would just come alongside you and just say, hey, looks like you're having a hard time. And I just want you to know that I'm here. And I saw that happen more. Yeah, again, I was raised in church, but I saw that happen more often in a church than out in the community or out in the general public.
Mm. Yeah, because you said something interesting there. You said like you saw that happen more in the church than you saw it happen out in the community. And the way
Community.
that I've
And the
started
way
to
that
think about community is it's not really community anymore. Like what we think is a community nowadays is nothing like what a community really should be. And I think that's one of the problems, the foundational problems behind so much of the ill in the world today is that we are not functioning as a community. And that's what we need. And so I'm already thinking back at the statistics that you mentioned about pastors being 94%, kind of positive ratings for people who are looking for some kind of guidance or help with their mental health. That's probably due to the fact, and you might be able to correct me if I'm wrong, probably due to the fact that all they really want is to feel accepted and welcome and loved and part of something. And so maybe through religion, even if they're not religious, and that would be a nice little way to dissect that information is to find out, well, how many of those people are actually religious? Because I'm sure a lot of people go to a pastor, even if they're not religious, and they're like, well, I've given up. This is my last line of defense. Let's just go and see what happens. And then they're like, you know what? I really needed to feel that. I genuinely, what do you think about that? What do you think about community today? Like what's happening with the world? What's wrong with the world? Let's just ask you that.
I agree. I do think that we have a huge issue where people just kind of, unfortunately, we're becoming a little bit more selfish than we used to be. But you're right. There used to be a time where, the collective whole was more important than the individual. And that's in a lot of different cultures, and that's in a lot of different communities. And that's certainly an issue. And I think creating community is one of those buzzwords you hear a lot in business. It's like, let's create community, let's create this culture. And I think that is important, but obviously it needs to extend outside of the business world. We don't just need to talk about it there. We need to talk about it, within in our communities. And connectedness is another thing. Being able to feel a genuine sense of kinship with another person, right? Finding at least one quality that you can relate to with another person, regardless of how they look or how they sound or where they come from or what's in their bank account, being able to connect with them on some level and be a real connection. The other thing in terms of the listening aspect, I think the reason that people will go to, again, a pastor or a mentor or a teacher before they'll go to a psychiatrist or therapist is because not just the stigma, but I think it is kind of connected to the stigma or the prejudice that they're not going to be heard, that they're not going to be listened to. And one of the things that when I started my practice, on my business cards, one of the first things that I put up there was listening without labeling. Because I think people will come to me and they're like, oh, you're going to call me crazy and you're going to put this diagnosis on me and then I'm going to be carted off to an asylum and what am I going to do? And I try my best to just be a sounding board for folks and just hear what they have to say first. And I think that's exactly what folks in a community do. You sit and you listen to the other person, and then you see how you might be able to support or validate what they're concerned about. The vast majority of people that I see that have already seen another provider that then come to see me in clinic, they will see me. The number one reason that they give is some form of communication problem. Either it's miscommunication or it's he wasn't listening to me. especially in the workman's compensation area. I just had a person who said, you know what, I'm going to send all of my referrals from now on to you, because I have patient after patient after patient that comes to me and they say, this doctor wasn't listening to me. I told them I didn't want that medicine and they prescribed it anyway. And then when I didn't take it, you know, there was this huge blowout. There was this
Wait,
huge
wait, wait, wait,
fallout.
hold on. So, what do you mean? Like, if they didn't take it, what happens if you don't take your meds?
It depends. So in a variety of cases, and I don't think we should practice this way. Let me just start off by saying this. And we've moved away as a medical profession from this, from that very authoritarian um, process. What we used to do is, and we still call it a doctor's order, right? What we used to say is the doctor says you need to do this, and then you did it. There was no questioning. There was no conversation. There was no negotiation or back and forth. It was, I've written you a prescription on an order form or a doctor's order pad, and the nurse is then obligated to follow that order through, and the patient is supposed to follow the order given. Kind of like in the military, you don't question your commanding officer, you just do what they tell you to do. We're moving away from that to more of a patient physician relationship where the physician is welcoming you as a part of the team. I see your shirt says team, but we're
Oh,
welcoming you.
this is a satirical. It's
Oh, I
the
can't see all of it,
yeah,
but
the
I see the
sports team from
team
my
part.
area is superior to the sports team from your area. I just love these stupid jokes that I wear around so people can see. Yeah,
No,
but you're
I
right. It
like
does say
it.
sport.
But in terms of team, that's what we're looking for in terms of the physician-patient relationship. I want my patients to be involved. I give recommendations, and I want the patient to say, "Oh, I feel comfortable," or "Don't feel comfortable." But one of the concerns that I have nowadays, at least in this particular in two instances that I'm thinking about, in the one instance, the doctor basically said to her, and this is report. I didn't actually speak to this physician, but the report from the patient was the doctor prescribed a medicine. I didn't want to take it. He then told me, if you don't take this medicine, I'm going to report it back to your workman's compensation agency that you're being non-compliant. And what happens if a patient is non-compliant? They don't show up to appointments. They're not an active member of their health care planning, and they're not an active member in their health care. Then what they can do is they can stop payment. So then the workman's compensation company, the insurance company, basically says, you're not participating in your treatment. You're not doing what you need to do to get better. We're going to end your benefits. And that is, I think, a very damaging thing for a patient, right? I mean, talk about a violation of trust. I'm not saying that there aren't some patients who are, again, that term, I don't like it, but that's the term we use, non-compliant. You're not complying with the order that I've given. You're not complying with the instructions. Again, I think it takes the autonomy away, the agency away from patients, but that's a whole nother conversation. What I am also concerned about is, again, if a patient has been given an instruction, like they've been told they have to do certain things. I see this a lot with upper level executives, as well as in the military, particularly when you become, like a commanding officer or certain areas. They have to abide by certain weight restrictions or health restrictions. They have annual physicals that are paid for by the agency or paid for by the military, and they have to meet that physical. And they also sometimes have to have, depending on where they are, depending on their security level, the security clearance, they have to have a psychological evaluation. And if I say, well, I think you need to take this medicine, or I think you need to be involved in this therapy, and that executive refuses, or that officer or that CO refuses, I can then say they're not complying with my recommendation. And if they're in the military, they can be demoted, right? And if they're in an executive in a corporation, if they're in line for a promotion, they could probably kiss it goodbye. That gives a physician a lot of power. Um, but I don't like that dynamic. I'll just be honest with you. I really don't like that dynamic. Again, I think it should be more collegial. I think it should be more of a conversation and a relationship, so that if I say to an executive, yeah, you really do need to be in this kind of a therapy. If they say, no, I don't have the time, and da da da, well, then I need to have a conversation. I don't need to just say, oh, they're non compliant, move on. No, I need to say, okay, what are the barriers? What's keeping you from being able to do this? How can we work around this? Okay, you don't like that. Well, what about this? And then it becomes a conversation, and then we hopefully come to a solution or resolution that's going to help keep them in the healthiest space that they can possibly be. Because
I,
right, because they,
I
they
think,
they need to be a good employee or a good entrepreneur or whatever it is.
yeah, I think it could come back to the whole kind of you've misunderstood me aspect of things. When
Mhm.
people are reluctant to take meds or follow protocols or guidance, it's like, why do people or doctors subscribe meds very hastily? Is it because they're on a quota? Is it because they're, how does that work?
Yeah, so no quota that I've ever heard of. I think that's a myth, and I'm happy to dismiss that. There's not a quota that we have to prescribe or that we get a kickback from pharmaceutical companies or anything like that. What does happen? There are two things that I've noticed. One is that we usually are on time constraints. I've noticed more and more physicians who are joining practices where there's not a time constraint, or they're starting their own practices because you can take the time that you want. For example, when I worked for a corporation, my follow up visits were 15 minutes. My initial evaluations were 30 minutes. When I was trained to do an initial evaluation in 90 minutes. And I remember trying to do it, in corporate and constantly being behind, constantly ending my workday late, and having my patients like have to wait for me because I couldn't do it in 15 minutes. I felt like I was doing my patient a disservice, and I just couldn't wrap my brain around all of the different things that the patient might be coming in with. So I was always either late or being compared to one of my other colleagues who was able to get them in and out in 15 minutes. Okay. And so there's time constraints. So I think that's one of the biggest things. So in my private practice, my follow up appointments tend to be like 30 minutes, and my initial appointments are 60 minutes to 90 minutes
Do
because
you
I need.
feel right? Do you feel frustrated still, like with the way that that works? Because I can imagine, as someone who you're clearly passionate about what you do. I mean, that's very obvious, and you want to help people, and it's almost like, in my profession, marketing, which is I have an agency, a marketing agency, and so if a client wants something done a certain way, but it's not possible. Like it's just not, it doesn't work like that. You have to spend the time. Like, for example, let's say if someone wants a branding for their business, but they want it done within a certain threshold of budget and time. That this is a creative process and you don't want to mess it up because it is essentially the identity you're giving your business. You don't want to mess it up. You don't want to do it in a way which doesn't connect the way it is supposed to connect with your target audience. So you feel like you're doing a disservice, right? You feel like you're somehow shortchanging this person, even though it's not your choice. And that's super frustrating. It makes you kind of feel, at least in my experience, that you don't want to continue doing it. You want to find a different way to do it. And that's why you're doing the combined, the CBT and the CPT, right?
Yes.
And yeah, like how is that going? Like, is it, you said there's no studies, but are you, because I was going to suggest maybe you should do the study. Maybe you should be the one who's doing the study.
Yeah, I'm hoping to do some case reports. And of course, you have to get patient permission. Well, you don't necessarily, but I like to get patient permission. But I'm hoping to do some case reports of both civilians that I have, so folks who have workman's compensation, but also military, because I have quite a few military folks that are, again, they're either being trying to be deployed or they're trying to do other things, and they have to have, it's kind of time limited, right? So I'll be following them and looking basically at their scores when we start, and then halfway between when we switch between CBT and CBT, and then their scores at the end to see, hey, look, if the scores got significantly better, if they stayed the same, if they got worse. The hope, of course, is that they get better, and the lower the number, the better the patient is. So that's the hope. Going back to the other question about, how do I feel about it, and what am I doing? Well, for myself individually, I just couldn't stay in corporate for a variety of different reasons, including the fact that, I needed the self care and I needed the family care and the family time. And it just wasn't working for me to come home at, to be gone all day. And then I'm coming home at 7 o'clock at night. And then I'm still doing notes and doing other work. And I'm just never there physically, or my body was home, but my mind was at work still. And my family, it was taking a toll. And, I think we've talked before about the fact that, I have kids with special needs. I have two children on the autism spectrum, and one is mostly nonverbal. And it was, again, I just felt like I was doing a disservice to my patients and doing a disservice to my family. So that's when I started my own practice, and I was able to dictate my schedule and how long I spent with patients a little bit more. And so that helped me. And then when I did have patients who have come and have said, hey, kind of like you said in the marketing world, where that it's not going to be done the way that they want in the time frame that they're given. It's like, fix me, Ayanla, fix my life or whatever. That's when I say, look, you do have these other options.
Look into my watch.
Yeah, yeah, you do have these other options, but these are the pros and the cons of it.
Right.
And anybody that comes in and does work with me, I remind them I'm not the only, show. I hope I'm not the only show in town. There's lots of other providers and lots of other folks that I do trust. If I have a wait list or I'm not able to see folks, then I will refer them to another person that I know is going to take the time. Now, does that solve the problem completely? No, because I know that there are still some of my colleagues who are stuck, working in jobs where they've only got 6 minutes to see a patient or 7 minutes to see a patient. By the way, that's the average number of percent of time that most primary care doctors are able to spend with their patient if they work, in corporate America. So I do work with other physicians, other colleagues who are trying to make a difference. And I think the tide started getting turned last year, I think. And I think more patients were able to see healthcare workers in a different light, to see that, hey, look, they really are doing the best that they can in the
Yeah.
circumstances that we have. And we do need to have some policy changes and some changes on the administrative level.
Mm. Mm. Let's talk about COVID then, now that you've brought it up. So, what changed for you? Did anything in your profession and your kind of direction shift because of COVID? And what's the landscape at the moment when it comes to, these kinds of your service? Is it just, did it go off the charts? Like, how are you dealing with that mental
It
health
did. It
epidemic that
did.
everyone says we're going through right now?
Right. We went through, again, our referrals literally just, I don't know, 4 times overnight. And we got so many more requests to work with other organizations, with other agencies. We've the thing that we did, let me back up and say, the thing that we did that was pretty much the same. I've been doing telepsychiatry since, December of 2015. So that wasn't new for me. And that was the majority of the way that I saw patients. I actually only saw patients in person once a week, starting again from December of 2015 up through now. The thing that changed a little bit was that I had already been introducing some healthcare providers to the concept of telepsychiatry and helping them. So and not just telepsychiatry, but telehealth in general. So I've been able to help a fair number of providers transition from working either for a corporation to working on their own, doing telehealth, or from working in an office to doing telehealth. So we just did more of that. The volume increased of folks that we had that we were able to help with that. And last but not least, one of the things that I think was huge, which I'm actually really, it's a bittersweet thing, because so many people were having such a hard time, and folks were more willing to talk about the fact that they were anxious. I think the stigma actually started going down a little bit. And it was okay to talk about the fact that you felt anxious and you felt worried and you didn't know what was going to happen. More and more people were admitting that they were having these feelings. I don't think that they just happened overnight. I think you were already dealing with people who probably were a little anxious anyway, who were just now, kind of opening up and talking about it because they felt safe. Because it's like, okay, everybody else is struggling. It's okay for me to talk about the fact that I'm struggling too. I think that was actually a really, really, really good thing.
I have my own thoughts about why the United States specifically is like an epicenter of mental health challenge right now. And I don't know if you mirror that belief, but it is, at least in the English speaking world, by my account, the most damaged nation in terms of mental health today. And I think that really boils down to the culture, the kind of pressures that are put on the individual to achieve, to produce, to appear a certain way. And there are other nations, obviously, that are going through significant troubles right now in mental health. But I keep coming back to the United States and I feel like because the culture made it so difficult for people, Americans, to open up about how they feel about them, their own health, their own situation, because you can't be weak. That's the culture. Don't be weak. That's my understanding. Don't be weak. Everyone's going to look down on you. You might be ostracized. So you kind of hold that emotional energy inside of you that needs to be released through communication, through sharing, through being vulnerable, through being transparent. And you keep it all inside. And now something like COVID happens, and it's like an eruption, like a volcano releasing all that kinetic energy. It's like that's happening right now. And that's why we get messages, and it's not all from the Americans, but even an organization as small as ours, that's just starting, really touching the tip of the iceberg in terms of content online, is getting people to engage with us and come and say, "Help me, help me! I feel like I'm going to kill myself." I mean, really, that's unheard of. I think that's unprecedented. So I don't know if you mirror my thoughts on that. It could be pretty sensitive, but I'm not saying it in a derogatory or negative way. I'm saying it in a very understanding and hopefully quite an empathetic way, that we really are seeing almost like a healing happening, right?
That's my hope, is that we will continue to see a healing happening. When you mentioned that, one of the first areas that I thought about was the area of race relations. And there's this huge push at this point for reparations, particularly from folks who are African American, but more specifically, um, uh, descendants of slaves. So there's a huge push in that area right now. And I'm hearing a lot of talk about that um, in a variety of different places. And Clubhouse is a bevy of activity right now related to that. And I think that's part of the concern. This is one of the United States is one of the few countries where you've brought a group of people. First of all, the group of people that were in existence here have basically been mistreated, right? And that's happened in many different places, right? In many continents and many other countries. But and eliminated. And then you bring another group of people in specifically so that they can also be subjugated. I don't know of too many other places where that's like that in the world. So I think that set up a very unique dynamic here in the United States. And then on top of that, you have other cultures that are able to come in, or other people that are able to come in. And there's the idea of, we're a melting pot, which again, I think we've gotten away from the consideration of melting pot. And now it's more of a salad, because you want everybody to have the ability not to blend as much as keep their own unique identity and augment. Right. And that's what a salad is. It's not everything losing their identity. I think we're hopefully getting away from people losing their identity and people still being who they are. But again, adding to or augmenting. So that was the hope. But so you're allowing other cultures to come in, or you're inviting other cultures in. But then when you invite these other cultures in, sometimes they're being subjugated as well, or at the very least discriminated against. And so it's kind of like you've got these layers that are being added. And again, there's not been the opportunity for the healing to take place, because very often there's not the apology, or there's not the acknowledgement. First, it has to be acknowledged, and then potentially an apology. And again, I think about this from a trauma perspective. If I'm looking at a person, because I get to work with both perpetrators as well as victims, I don't like using those terms, but for conversation purposes, I get to work with both. And sometimes I get to see reconciliation between the two groups. And I love it. I love when I get to see that. I'm not saying they're going to be friends and going to be cordial. I mean, they're not going to be friends, but they can at least be cordial, and they can at least go their separate ways and in peace and forgiveness, which is always the end goal that you want to have. I've not seen that for any of these groups on a holistic way. I've seen kind of some minor conversation with Native Americans, some beginning conversations with African Americans, and then these other cultures that, again, are having these difficulties. You're just now starting to see the conversation erupt, just like you said. I think the healing can come. Gosh, I hope it comes soon, but I think it can come. But I'm also very, very optimistic. I have some other folks that I know who are not quite as optimistic as I am and are very concerned that we are headed to more of what we had happen last summer with, you know, again, just a bevy of activity that wasn't always good activity.
Yeah, I hope that it doesn't go that way. It's very tricky. I mean, I don't know. I don't know the answers to any of these issues, and I'm very disconnected anyway. I will say this: what we see on the media is probably a really bad reflection of what's actually the reality of the situation. So I kind of want to tell people not to trust the news too much because it really does kind of promote whatever agenda it wants to, and it's not always the truth. So, but I really do want the best for, I think everyone's looking at America now to really kind of like see what happens, because the country is the, it is the, like the poster child for freedom and equality and justice, and all of those traditional American values that unfortunately have kind of like lost their way a little. And so we want them to come back. I'm pretty confident, like I speak for most people, we want to see those resurface, but it's going to take some amazing leadership. Like really, I can't understate that enough. That's the problem. It really is leadership, and the leadership needs to be better than the choices that Americans have been given up until this point. So yeah, but without making this a political conversation, I mean, because we're really diving into it now. But you talked about expressions, and I think we're talking about expression of ourselves in a way that we don't feel like we're being judged too harshly, or put on the pedestal and criticized. How do people? What would you suggest people do if they're having mental challenges? Like we were going to discuss expression of those and how to do it right and who to do it with. And
Yeah. So there are so many different outlets that people can go to nowadays if they are looking for help and hope. Um, there are some great places, and time wouldn't permit me to just go through a laundry list, but in general, we don't really have an excuse for not being able to connect with some form of help. It really does take the impetus to go and try to find it. I was talking to a gentleman recently, and he said, if people are ignorant of certain things, now there's no excuse. There's the internet. So if a person says, hey, I really do want to go and find help, there are some great sites. I love NAMI, National Alliance on Mental Illness, because they give broad information. And then they also give specific things if you're looking for certain things. Like, for example, if you say, I need to be connected to a support group, they have a site that's just got information for that. If you say, well, I'm a person of faith and I want to be with someone who understands what I'm saying when I start talking about certain things that maybe no one else understands, spiritual things, for example. Well, they've got a faith net, a specific area that's just for that. And then if you need to just talk with somebody and you're just like, well, I just want to pick up the phone and talk with someone, there is a lifeline. We used to call them suicide hotlines, but now I think we like to refer to them as lifelines. There's a lifeline for every major country. And if your country doesn't have a lifeline, it doesn't mean that you're not major, but for all of the ones that you could think of, literally there's a list from A to Z. If you just Googled lifeline for your particular area, wherever you happen to be, you can find a lifeline that you can call and talk to a trained counselor who is a volunteer, but who's a trained counselor who can talk to you about anything that you bring to them. Okay. So there's a lifeline that you can call. Now we also have text lines, and I know there's a text line, there's a crisis text line that's connected here in the United States as well as the UK, and it's spreading. They're getting more and more of them. Here it's 741-741, and then you can text whatever you want. You can text home crisis. If you're a healthcare worker, you can text frontline. If you're an officer, there's some things that you can text as well. So if you just want to text people, you can do that. I'm really, again, a big proponent of telling people to reach out to folks right within their community. If you've got a person, and I know we're virtual, but if you've got a person that's within your household, within your space, or within your workspace, there should be someone that you can talk to. If you feel like there is absolutely no one on the work side, lots of people don't know that you have access to an employee assistance program. If the company that you're working for hires more than one person, they've got access to an EAP, which means you've got access to an EAP. So if you're struggling with something and you just need to talk to somebody, your workplace is a great place to start because that can be very confidential. No one needs to know about that, pretty much except you and whoever the employee assistance program person is. And it's usually someone that they've contracted with outside of the organization, and they've specifically done that so it can be confidential. So through your workplace, you can reach out to people. Most folks don't realize it, but our school systems are set up so that if you're having an issue at school, almost every school has access to a school psychologist and or a therapist. So if you're doing, my heart really feels for moms and parents who are now having to become teachers with the e-learning. So they may not know how exactly to reach out to someone. You can always reach out to your child's school. And there, I know in this area in our state specifically, they've been promoting having parents reach out on behalf of their children, but you can also do it on behalf of yourself and get connected to someone for therapy if you're struggling during this time, which I think is a huge thing because I think we forget about parents and the struggles that they're having right now. And I say moms because I'm a mom, but that goes for dads as well. So those are just a couple things, but
Oh, that was a lot. That was good. You gave a lot of advice there. So I'm sure there's something there for everybody. And what I wanted to add to the conversation was this. For me, I'm extroverted by nature, but not to the edge of the spectrum. I'm like close to the center, but I'm a little bit towards the extroversion. So I am technically extroverted. But there are times when, and especially during the last 12 months, where I feel like I can't be bothered to talk to people. I really just can't be bothered. I'd rather just kind of go through the day by myself. And unfortunately, for someone like me, it's not healthy because I think a lot and I overanalyze things. And if I'm sad about something, I'll get even sadder about it, right? So having someone around is good to take my mind off of it. And also, if I want, I can even just start to edge myself into that conversation about like, how do you feel? Like, what's going on in your life? Oh, well, then they ask me, how do I feel? And I tell them a little bit. And then we end up talking about it eventually, and it's fine, right? The reason why I'm bringing this up is because it's so easy for us to forget that it's normal to be around people. It's normal to be in the vicinity of someone and enter into a conversation, even if it's just about opening a door for someone or how you doing, what's the weather like. But we have those micro connections. At least we normally have those micro connections. So for this last year, we have to almost force ourselves, if we're the kind of people who maybe can't be bothered to talk to someone, right? We kind of have to be our own support and our own adult and say, just talk to that person, even if it's just for 5 minutes, just to say hi, just to say hi. It's like when a personal trainer is trying to convince you to go to the gym, they're like, just put your foot in the gym, just set in foot in the gym. Doesn't matter what you do. And eventually you'll end up sticking around for a while and hopefully get further towards your goals and be happier. And I feel like I just want to say, just try to connect with someone every day, just one person, because that's normally what would happen anyway, right? You know,
Mhm.
in a healthy world anyway.
Absolutely. And the connections, I love the ingenuity that we've come up with over the past year in terms of the ability to reach out to people even virtually or by phone or, what, however you manage to do it. But two other things that I was thinking about as you were sharing that. One is that for the person who's the super introvert who's like, I'm not going to pick up the phone or text or reach out to anybody. I'm struggling, but I'm not going to reach out to anybody. One of the things that I do recommend to people, if they're really uncomfortable with reaching out to someone, there are, the self-help book industry and just the self-improvement industry is like billions of dollars worth of tools and resources out there. I've actually seen some really great books that are, you name the issue that you might be dealing with, there is a good self-help book out there on that. There are also some really good courses that I've seen. We have, this is not a self-promotion thing, though. This is just literally an example. We created a Victory Over Depression course because I had lots of patients who kept asking the same questions again and again. And I thought, let me put this in writing for you so it's easier for you. Because when you're depressed, you're not going to remember certain things. And we forget 60% of what we hear in our doctor's office, even when we're not depressed. So we wrote the book specifically for our patients and other folks who wanted to work with us, but for whatever reason couldn't, so that they could get better. Then we developed the course for folks so that if they were struggling with depression, they could go to the course and they could go. And that was basically having me alongside them, talking with them to help them get through whatever they're going through. And that's just one example, right? I'm just one provider. There are so many other folks who've done similar things, who've created these things for you. So if you're just like, you know what, I really don't feel comfortable reaching out and talking to anybody, there's probably a book or a course that you can do that's going to at least help build the confidence and help you feel better so that maybe you will get to the point where you feel comfortable reaching out to someone. And then in terms of the connectedness piece, I totally agree. And I'll give you an example of something that I heard someone do last year that I thought was like the coolest thing. They had thousands, of course. We always have hundreds and thousands of followers on our Facebook pages or whatever your favorite social media page is. This particular person decided that what they would do is reach out to every single person on their list. And so literally they made a goal of either, once a day or, a couple times a day if they had more time, going through and connecting with one of their friends that was on their list. And they just went down and just simple, hey, I was thinking of you today, and I just wanted you to know I was thinking of you. We never really connect on, you're my Facebook friend, you're my Instagram follower, but we never really connect. So I just wanted to send you a message and let you know I was thinking about you. That's a connection point, and I really liked that. That wasn't mine. I'm borrowing that, but I liked it, so I'm sharing it.
So simple to do. And yeah, no, it's totally in your control as well. So that's really empowering. And funnily enough that you mentioned that, I get messages now and again from people that's really just, hey, I was thinking about you. And I was like, maybe they're following your course. Speaking of which, tell us about the book or the books, because I want you to be able to, bring awareness to the things that you're doing to help others. So what books have you authored? And let's discuss those for a while.
So when either my patients or my clients, because I do some mental health coaching, when they come to me and they bring up an issue that's kind of a hotbed issue, or I see multiple people bring it up, once I kind of hit a certain number of questions, I'll write a book about it. So, so I had the first thing I had were questions about depression, particularly for people of faith. And so I wrote a book, and it's not specifically for people of faith. Anyone can utilize it, but I specifically chose Job so that people who read the Bible and understand, lots of people resonate with Job. Even if you've never read the Bible, it's like almost everyone has heard of, you've got the patience of Job, right? Because Job went through all these horrible things. And it turns out when you look at the symptoms that Job had, there are 9 symptoms that can qualify you for a diagnosis of depression. Job had 8 of 9, including thoughts to harm himself, including thoughts, because he said, I'd rather be dead. He's like, I wish that he's basically said, curse the day that I was born. So that's some pretty strong words, some pretty strong language. But we wrote a book about depression, Victory of Depression, with and without medicines. I did the without medicines part because the very first thing that I get as a referral for lots of people, if it's not the miscommunication issue with the previous provider, it's, I don't want to be on medicine, and I heard that you can help me get better without a medicine.
Let me ask you this. Do you think it's possible to get cured? Do you think that medicines are absolutely necessary for healing from deep psychological traumas?
Yes and yes and no and no. And that's a tricky question. And the reason is I take a very broad view of medicines. I think you definitely can get healing and hope without pharmaceuticals. But nutrition can be a medicine. Um, Exercise, anything that you're doing. So the National Council for Complementary and Alternative Medicine said anything that you put on your skin or in your body for the purpose of prevention or treatment of an illness is a medicine. So there are some nutritionals that we could do consider medicine. And depending on who you talk to, if they broaden that spectrum, yes, I do have some people that utilize, I've got a lot of people, a lot of athletes that utilize exercise as their antidepressant. I have a person who's, well, I got people that use a lot of stuff. And that's what they use. And I think that you can certainly get healing in that way. Um, I also have worked with a lot of folks who are parents who have struggled because they have either a child that's experienced a trauma or someone with special needs. So we wrote something for them. We have basically a study for folks who have experienced that. We have, and I say we because I co-authored these with Dr. Amir. I'm Dr. Bergina Isbell and Dr. Amir Isbell. We co-authored a book. We released it last year. This is the one that became the bestseller before all the stuff happened. But it's a 2020 vision book that we wrote. And it's basically like a devotional, but it was one of those things that I think it was just kind of helped people with grounding, with just kind of starting their day off by thinking about things that were going to keep them productive and keep them healthy and keep them thinking, from the broader perspective, having a nice worldview, like you talk about community. And that's what we did. And we did basically almost all the things that we've done like a course that's related to it for the folks that are like, okay, I'm not going to read your book. I don't have time for that. Even the audiobook, I'm not going to read it, but I like the stuff that you're saying. I like the things that you're talking about. And so then we would go ahead and develop a course related to it for specifically for folks that asked if they were struggling with things. Like I said, we worked with a lot of folks who are trying to transition either into their own healthcare business to kind of change the spectrums, change the landscape, one provider at a time, or they were interested in transitioning to telehealth. So we created a course called, I think it's called Doing Business with God. And that was more for folks who had, a spiritual background who were saying, you know what, I'm kind of struggling in this area and I need some help. So, we created a course. So that's what we do. We try to help people individually. And then if we notice a group of people having the same problem, book in a course.
Right. Yeah, that's a smart way to do it too. No, but it's very good that you're doing it. And so the name of the books are Victory Over Depression with and Without Medicines and Come to the Table, a devotional for caregivers and families of children with special needs. That second one, I'm not surprised it was a bestseller because there are many families with children with special needs. And I can't think off the top of my head, and I'm not a parent of a child with special needs, but I can't think off the top of my head of any books that I've seen that are really covering that aspect of life. So, how's that been for you?
Yeah, it was the first. There actually are two, and it was the first. It was interesting. We wrote that in 2019, I think, and we published it. And literally right afterwards, Gary Thomas, and I don't know if anyone knows who he is, but I think he's the author of the Five Love Languages. He created one along with another person who is uh, I want to say a parent of a child with special needs or a therapist. I'm not 100% sure, but he created a book with her. So there are two, which I absolutely love because if you're a parent of a child with special needs, and that includes special medical needs, that includes mental illness, uh, then you need the support because, every day is an adventure. And, some adventures are a little bit more tough and difficult and rewarding than others. I wouldn't trade my experience for anything, but I do know that there are times, as a mom, putting my mental health psychiatry hat off, you know, as a mom, I think it's one of the toughest parent. I think it's one of the toughest jobs that you can have because you're constantly trying to figure out how to pour into another little human and raise them up to be, not a sociopath. That's the way I think about it. Because that's the psychiatrist part of me that's like, oh my gosh, these are
Right.
all people that we
Yeah, I was
have
going
to
to ask you
just
about that. I was going to ask you like how your work bleeds into your relationship, and do you kind of like say to your husband, although he's a doctor too, so. But I was kind of thinking that must be pretty entertaining sometimes, at the dinner table. Like, that's a sociopathic tendency right there.
we've had those, not the sociopathic part, but we've had those where it's like, you know what, you're doing da 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 da, or we'll do that, and I don't think we mind it. But my daughter, was 18 for a long time. To me, she's still a teen. She's 18 now, so she's technically an adult. But I remember recently she said, "Mom, don't therapize me," and I'm like, I don't even think that's a word. What I know what you mean, and I'm like, I'm not therapizing you. I'm just, I'm like, I'm not doing therapy, and I was like, I'm not your therapist, so I'm not doing therapy, but I'm just offering some words of wisdom, some words of advice. And she's like, but you're doing therapy. Like, you're
It's
therapy
so hard
is
to
therapy.
like say,
And
okay,
I'm
here's a line.
that's not therapy. But she's like, yes, it is. So yeah, it bleeds through sometimes. I do try to separate, and especially both the physician part as well as the psychiatry part, we do try to separate. And sometimes it works out very well. Sometimes it doesn't work out as well as I would like. And, in all transparency, there have definitely been times where I've said to myself, oh, I think this is what's going on with my kids. I think they need help in this area. I think they need help in that area. And sometimes I've been told, no, they're fine, they're okay. And they really did need help. And then I'm kind of going through the regret of, oh gosh, I should have pushed harder. I should have been more of an advocate because my medical knowledge and my gut told me something's going on and I let it drop, and I shouldn't have. And then there are other times where I'm like, oh, this is going on and that's going on, and I push, and then it's, Mom, you're okay. They don't have this. My 5-month old, for example, he kept having all of these digestive problems, at least to me, and I'm like thinking through my mind, we probably should have him see a gastroenterologist. And if that doesn't work, there's these MRI enterographies that they can do where they look at the bowels. And so I'm kind of going through my mind all the things. And his primary care doctor was like, who's a friend also, who just said, no, he's fine. Like, he's okay. He's normal. And she's like, it's reflux. She's like, put a little rice cereal in the bottle and keep the head of the crib up or the bassinet up and he'll be fine. And he was. So it's
Yeah.
interesting.
You're like your own Google, which is a bad idea. It's a bad idea for many people. Yeah, I do that
Sometimes
sometimes. Checking Google to see like what's wrong with me, and I have no no way to like know where to like distinguish between paranoia and not. So yeah, no, look, this has been such an amazing conversation. I can't believe we've lasted this long talking about this. So there's so much that you have to offer. I really highly recommend people get in touch with you, buy your book, find out more about you. How can they get in touch with you? What's the best way to do that? Social, email?
Yeah, honestly, the social is a really good way because I do respond back to folks that connect with me on Instagram or wherever. I'm not as much on Facebook, so I will admit that. But on Instagram, I usually do try to respond. It may take a little while, but I definitely respond to folks that way. And the website, which is ledlifellc.com. We talked about those L's earlier, but it's like you're being led through life, and then llc.com. And there's usually a way for you to get in contact with me there. Actually, some folks have wanted to have a quick conversation about something. They've got a question, or they're working with their provider on, and they want to know how best to communicate. Because if you're struggling with another provider, they've got the training, they've got the expertise, they know you. I usually don't want people to just like ditch their personal provider and then come on over and work with me. Sometimes they can't even come and work with me, but I will talk with folks and try to support them. And I've definitely had conversations with people to say, hey, look, these are the questions I want you to go back and ask your doctor, or this is the information that I want you to go back and share with your doctor so that you can open up that dialogue, so you can open up that conversation. So that's a way to be able to do that. There's a discovery call application, and then there's a discovery call link.
Mm. I think we've got a lot of things we can put here in the bio, so in the description rather. So I'm going to do that. Look, it was a real pleasure talking with you. Thank you so much for coming on the show. It's been an amazing episode.